I would like to show you what is my stance for the final work. Okay, so the number one options, they can take it out all tooth and they can place implant. It's number one option. Okay, so my treatment plan option is here. So this one is out, and this is out, this is out. Maybe I can grind this. So what I do right now at this point, in order to make the treatment plan wax out, I'm okay with this, but in order to bring everything, first I have to cut it. It's out. Okay? So I have to make it smooth. So here, after they extract this, that's for sure. Okay? Number two, this is out. Okay? I do same thing. Okay? This is out, this is out. Okay? Now here's two, it's really fat. And then tip to the outside. Okay? This is out too. Facially out. Okay. Now check the occlusion. Compared to side views, really out. So, I'm sorry, this is a bite. Still really out, right? So what I'm going to do, this is a baseline practice. So I maintain the midline. Okay. Putting it in as much as possible. Especially facial area. I hardly grind lingual. So I make the nice deep chamfer types of the linguals. I hardly grind them. But I made the slightly chamfer. Okay. This is my guideline to wax off. But I'm going to make the central, lateral, premolar will be canine looking. Okay? So I have to prep it, or they have to make the crown prep, not a problem. So which is we're talking about fixed concept. But it is okay, they can take it out the tools, they can make place implant, and then they can make 4-unit, or it's really hard to get the proportion, right? But they have to imbibe this. Anyway, so this is my starting point is maxillary. So I'm grinding down, and then grinding this and make the 3-unit. Here is another central and the lateral, and then this is a canine will be. I'm going to make the crown prep. And then now regarding lower, okay, it's really out to two teeth. Same concept. We have to cut it, extract it. Same thing. But the problem is the lack of space, so I have to take it out this one too. Otherwise I cut it this much, which is almost not possible, so they have to take it out. Maybe I can save this. Here's a little bit to facially. Here I'm looking for the prep. Here's the middle line. Here's the central. Here's the lateral, and here's the canine. So I have to prep this. which is the crown prep. Alright, so here's I have to break it, then more, so then I can make the better room. Here. Now same thing, let's cut it inside the edge. I want this good alignment. This is a little sticking out facially. The good alignment compared to this. There's occlusion. So I'm okay with that. And compared to size piece. Okay, so I'm going to cut this. Cut this. Okay. The mesial prep. That much. Trying to save the canine, we'll see. I don't need this limber. To break this one mesial that much. And I need a passover insertion. Fitting. That one straight. Okay. Good. Now cut it, the rest. Facial, distal area. Cut this. Like that. So one canine will be one lateral. So I have to open in between a little bit more, which means this area. Okay. Now this one too, a little bit. Look at this. Same thing, size edge, facial head. About 1.2 millimeters. Okay. So the key is the embrasure a little bit more open, then I can move to left or right. I prep really well. Now this is one canine, one lateral, one central, one lateral, so I can compensate it. Not only this, here so I have to make a little bit more parallel. Okay, that's good. Now the other things I have to using is smooth carbide bar, and then I have to grinding. The roof area makes smooth. Trying to make compact pipes. Same CJ. Alright, so that's my starting point. The linger, we get here. After looking like that. Okay. Now it's all for same things. I have to grinding. Convex pocket. Okay, we get here. And I need lateral looking convex. wax. And this. So I got the same CJ, the lateral. Now, it's up to them if they, now two options. If need they fixed, I need a crown prep. Okay? Or other option, they can extract it, they can place the implant. Or, but they have to place implant really well according to my wax up. Same thing. Same as lower two. So we're trying to compensate it for tooth. But they can place implant as well. So this is a fixed concept, and the other concept is implant. So it's up to them. So now I have to write clean, and I'll show you the picture, and we'll be done. Okay. Alright, this is controversial cases. Many things you can do. It's like Canine took it out, and then stretch out they can do ortho. That's one option, right? And the patient refused, don't want to do it, and took it out. This is their planning actually. Extract teeth is upper 4, and then they want to place implants, and the lower as well. So here's my treatment plan wax up, and from this, after I took it out, remain this tooth, and then I trying to save the 3 teeth is my standpoint, laboratory side, and finish like that. Okay, we don't have to do right now 28 is okay. This is 28, 22, 21 is okay. However, change dramatically. Make it a little bit bulkier, which is way better than before. That was our treatment plan wax up. So it's a lingual anatomy and contour. Okay, that was anyway. So here's the before. So now from here to all the way here.